1.2% of the world population suffers from epilepsy, and 300,000 people have it in Canada. Additionally, 1 in 26 people will suffer from recurring seizures. That's why today we'll be talking about phenytoin. Phenytoin is an anticonvulsant that prevents the occurrence of seizures. It has a chemical formula of C15, H12, and 2O2. But before we get into how phenytoin works, let's understand how seizures work.
The brain is built up of a bunch of neurons which transport information to each other by electrical impulses. These impulses may look like they happen very quickly and chaotically, when in reality, they are very organized and balanced. We can see this in better detail by looking closely at the process.
Let's say this cell is a glutamate neuron, a neuron that excites the brain to send impulses. Say an action potential comes in, it will cause an influx of sodium ions via the sodium channels, and once the impulse works its way to the axon terminal, it will cause the calcium channels to open up to cause an influx of calcium ions. This will cause depolarization, as the interior is now more positive. The vesicle in the terminal bulb will release glutamate, a chemical that nerve cells use to send signals to other cells. Glutamate will bind onto the receptors or channels in the postsynaptic neuron. In this case, the glutamate neurotransmitters are binding onto AMPA and NMDA channels, and this would allow sodium and calcium ions to enter, causing depolarization in the postsynaptic neuron. The depolarization will reach a threshold and will cause an action potential and stimulate other neurons in the area. If this entire process happens consecutively and rapidly, a seizure will result. This is where phenytoin comes in. Phenytoin binds to a specific site on voltage-dependent sodium channels and exerts its anticonvulsant effect by inhibiting sodium influx through these voltage-dependent channels. Therefore, it suppresses the repetitive firing of neurons. Through this action, phenytoin obstructs the positive feedback that causes the development of maximal seizure activity.
Now let's understand how the body digests phenytoin. The phenytoin pill is taken orally and is then transported through the esophagus to the stomach once swallowed. The digestive juices in the stomach help to break down the tablets so that they release the medication. The medication then moves to the duodenum, where it is absorbed in the villi and transported to the liver via the hepatic portal vein. Since the drug is now in the bloodstream, it will bind to the albumin protein in plasma and be carried to the action site, or in other words, the brain. Once the phenytoin has done its role, it starts to break down or metabolize in the liver. It is excreted in the bile as an inactive metabolite, which would then be reabsorbed from the intestinal tract into the kidneys and then excreted in the urine. Urinary excretion of phenytoin and its metabolites occurs partly with pressure filtration, but more importantly by tubular secretion.
Since it is understood how phenytoin works, we can take a further look to see which enzymes, hormones, or neurotransmitters it affects. One of the most abundant neurotransmitters in the body would be glutamic acid or glutamate. We already know that glutamate stimulates nerve cells in the central nervous system and know that too much stimulation is the cause of seizures. Since phenytoin prevents the sodium channels from causing a cell to depolarize, it will also prevent the release of glutamate when depolarization occurs, thus causing a decrease in glutamate levels. Another neurotransmitter that phenytoin affects would be norepinephrine, a chemical that is released predominantly from the ends of sympathetic nerve fibers and acts to increase the force of skeletal muscle contraction and the rate and force of contraction of the heart when in stress. By ingesting phenytoin, it would inhibit the release of norepinephrine since the neurons won't be in stress and therefore inhibit contractions from occurring.
Taking phenytoin affects the enzyme alanine aminotransferase, or ALT, by elevating the enzyme level. And ALT helps the liver break down other proteins so that your body can absorb them easily. It plays a crucial role in metabolism, which is the process that turns food into energy. Phenytoin can cause many side effects, causing liver disease or liver failure, which would release ALT into the bloodstream. High levels of ALT can be prevented by taking the drug Livatone, which will detoxify the liver. In a few cases, it has been seen that phenytoin affects the thyroid hormone. Phenytoin modifies the cellular effects and decreases thyroxine levels. Therefore, phenytoin would reduce levels of the thyroid hormone, causing hypothyroidism. Some symptoms from this could be fatigue, weakness, hair loss, and depression.